Welcome everybody, welcome to Innerspace in 4 to 6 Johnson Street, Collingwood. I'd like to welcome you here and first of all acknowledge the traditional owners of the land here, past and present as well. Okay. Maybe I'll spend a couple of minutes, tell you about the services that we run from here, what we operate, a little bit of the history of the service, and Greg can talk a little bit more about some of the work that he does as well. But if you've got questions or queries as we go along, please feel free to ask me, and Greg as well, I assume. But Innerspace is a primary care health facility that was set up a number of years ago now, about 14 years ago, with some money that the state government rolled out around the hotspot funding. And this service is really designed to meet the needs of people that often aren't very welcome at other traditional services in the community. So the majority of people that we tend to see here are people that are often homeless, often IV drug users, have a number of issues that they bring along with them, mental health issues, long history of trauma, etc. We tend to operate as a bit of a one-stop shop, so we've got primary healthcare, doctors, nurses, pharmacotherapy, needle exchange, allied health services, dental services, hearing services, a range of those wraparound health services. Then we've got AOD counselling services and specific dual disability counselling services that operate out of here as well. And the workforce, the space that you're in right here at the moment, I won't show you the clinical areas, but the space, we use this as a drop-in space. So we're open for 2 sessions a day from 11 o'clock to 1 o'clock and then from 3 o'clock to 5 o'clock. So people can come in here, have a shower, do their laundry, have something to eat, and talk to the staff that work here around what's going on and get assistance for them around things like homelessness or linking into counselling or what's going on around their health needs, and a range of other issues. They come with, you name it, people come here with those sorts of issues. We operate 5 days a week, and I also manage a number of needle exchanges. So we've got a needle exchange down at Collingwood Community Health Service, where I think you've already been. We've also got another one at Fitzroy as well, and we've got one here. And we also run an outreach service at night that operates till 11:30. And the hotline, I don't know if anybody's used the hotline, but the hotline's there for people that find used equipment in the street. You ring the number, that goes through to us, and I've got a team of staff who basically spend the day picking up used material, injected material off the streets of Collingwood and Richmond during the day. That's about enough. I'm sort of looking, I don't want to really, but if people got any questions they'd like to ask me or any queries or wondering how many people come in or whatever, yeah, sure.
Funding situation like at the moment?
Oh, everybody's funding is always precarious. Good question. It's a year-by-year thing. The money comes from the state government, primarily. Part of our service is a little bit self-funded as well, the GP practice. We are always trying to scrape together more money to run programs. I didn't also talk about some of the other things that we do, but the council also gives us a little bit of money specifically to run an art program and a men's health group as well, which we operate as well. So it just, services like this, you could spend triple the amount of funding easily and still not make a dent in the community. I think it's one of the tough things for all services like this. I'm sure if people work in it, they know themselves what it's like, but you're forever having to put in grants or, sort of like trying to convince the staff, yeah, we're going to be here next year, unfortunately. Other sorts of questions? Then in that case, yeah.
In the mental health space, the state government moved away several years ago from funding sort of day programs where people drop in and stuff.
Yeah.
You've managed to keep that going on for, is that through AOD funding or is it you fund that yourself? Because it seems to be an area, a neglected area, and it's great to hear that you do it.
I think a number of our clients, I suppose, are people that really struggle to engage with the mental health services. So the mental health services, I think, are really strapped. There's a huge demand for mental health services. in the community at the moment. And I think they're really struggling to meet that demand. My background is AOD and mental health, and I suppose what I tend to see is that most of the, particularly the tertiary end services, really struggle to meet the demand of the community about what's going on there. I think that's compounded when people have got a dual disability or using a range of substances as well. And a lot of people find it really difficult to engage with the tertiary services given their lifestyle. And, you know, some of the people that we work with, they don't have anywhere to live. They live, you know, underneath stairways, in squats, etc., etc. So they haven't got what you would consider to be an address, or they're not at a particular place at one time. They can have a lot of difficulties then even turning up to appointments with people, etc. Hence the need for a service like this one, where people can come to at any time and just sort of drop in and get the supports that they require, etc. So I think around some of the difficulties around the mental health area at the moment, depending on what happens with the election, there will be probably, if this current government stays in, a Royal Commission into that area, which I think will hopefully be a good thing if they get to shine a bit more of a light on it. It definitely, from my perspective, I suppose in that area, if you were to look at just mental health issues, there are services around, but if you've got, you know, a range of other baggage that you're carrying with you, then it can be really difficult to engage with those services, and the clients find it really difficult.
Thanks.
Have you noticed any difference in the services you've been required to provide since the injecting room came up?
No real differences from our perspective. A number of our clients do use the service. Some of them use it, some of them don't. It's in Richmond. The service is just new. I think it'll take a while for the service to bed down. I think it is a really good service. Personally, I think there's a real need for places for people that can go and be safe, and that's one of them. I haven't noticed any real major changes in the demand, both for our services or the sort of services that we provide around the needle exchange, that's for sure. I think it's a bit too early to tell as well. But, you know, I suppose I'm a supporter of that service. Some of our staff work here and work there as well. And we do know that as I mentioned, some of the clients do use it. It just really depends on where they're at in, you know, what they feel comfortable with, etc. I'm not an expert on that facility. I can talk more about here. But I think the patterns of drug use and where people use them, how they use, is also quite complicated as well. Greg, did you want to say a few words? Sorry.
Thanks. Look, just that as the Executive Officer for the Yarra Drug and Health Forum, we were, I guess, at the forefront of the campaign to get the injecting room up and running. And that campaign had been running for a long time. I don't know whether you're aware, but some people in the room would be aware that a campaign to get an injecting room, or several injecting rooms, started in the late 1990s in Victoria. And that was due to a heroin glut and a lot of people dying. It was greater than the road toll. And this area in particular, Smith Street and North Richmond and the city and St Kilda and Springvale and Dandenong and Frankston and other places, Footscray, all had significant issues around heroin use. And funding came out, hotspot funding came out to implement injecting rooms, but it was defeated by the government, or in Parliament I should say. And so the funding that Paul mentioned went away from the injecting rooms, and a number of these primary healthcare facilities were set up. But the Yarra Drug and Health Forum, because we're based in Yarra, and because we have, I guess, we're there to really campaign or advocate and promote policy reform, was aware that there was a growing and, in fact, an increasing drug market down in North Richmond and Abbotsford. Excuse me. And from the mid-2000s onwards, that market started to grow and grow and grow, and it became obvious that a similar open drug market, similar to what was happening in Smith Street and other places in the late 90s, was happening down in North Richmond, Abbotsford. And towards the late 2000s, we produced a position paper through the Burnett Institute, which highlighted the fact that there was a need for an injecting room. We campaigned on that. Unfortunately, we didn't get a lot of support at government level. The council were very supportive. They voted in favour of setting up a pilot program for an injecting room in 2011. What we were basically saying was that there was a drug market down there where people were injecting in public, there were drug-affected people, there were needles and syringes everywhere, and there were people overdosing, high call out for emergency services. It gained momentum. The government still said no. There was a Liberal government at that stage. But what we were starting to notice also was that the high number of overdose deaths at that stage. And so we kept campaigning. We produced another report highlighting, I guess, the need for the injecting room. A number of other agencies, a number of other people started to get on board. We got a number of agencies such as the AMA, Pennington Institute. The media was very supportive of the campaign. We've always had strong support. There was a coronial inquest into the death of a young woman in Hoddle Street. So I guess in terms of advocacy and campaigning, there were more and more groups that were saying, look, this needs to be done. And I guess 2 years ago, a significant move was that the residents, particular residents in Abbotsford, became heavily involved. Up until that stage, the residents were a bit ambivalent about the idea. The traders were not that keen, but they said if it was going to happen, it should happen, but not on Victoria Street, because we were initially proposing a centre like they have in Sydney, which is in King's Cross. But eventually, of course, they agreed that, okay, if it's going to go ahead, it won't be on Victoria Street. And we went into the 2014 election knowing that the state government said they would not implement an injecting room in Victoria. They made that quite clear. However, I guess the overwhelming evidence, and particularly the personal touch from many people who'd lost kids, young people to heroin overdose, started to have an impact. And as you would know, in October last year, 12 months ago, they said that they would set up the injecting room in North Richmond. So there's a temporary site down there, which is part of the existing health service, and there's a standalone purpose-built site which is now being built in North Richmond, where the car park is in Lennox Street. So that's a very quick synopsis of, if there's such a thing, of what's happened over the last few years. And at the beginning of that campaign, we knew it was going to be a challenge. But we also knew that that the evidence was on our side, but we just need to ensure that we promoted that evidence and ensure that there were a number of agencies, groups and others who were supporters of that campaign. So, and I believe, as Paul said, it has been successful, even though it's only been open since July. So thanks for the opportunity to speak today.
Great work.
Thank you.
Matthew Guy has said he'll close it if he gets the chance, hasn't he?
Yeah, look, he has. Whether he does or not remains to be seen. Obviously, we hope that he doesn't. People will die.
We hope he doesn't get the chance.
That's right. We hope so. But if you follow, most people, I think, would follow what's happening in terms of the campaigning and would know that his strong suit is law and order. So the injecting room is kind of symbolic of that. So they're not running a candidate in Richmond. So he's got nothing to lose, really. He can keep referring to that as an example of, I guess, the breakdown of law and order. So that we know that, we recognise that. It's purely political, but it's one of those things you have to acknowledge.
I had a link for not running a candidate with the injecting room.
Yeah, well, we had a forum last Thursday at Richmond Town Hall, and we invited several speakers. Every time election comes up, we invite speakers from the various parties to come along and speak. And we did invite the Liberal Party, but they refused our invitation. So we know it's political, but that's the nature of the world we're in. So yeah.
The Yarra Drug Forum, too, if people are particularly interested in issues around this area, I highly recommend that you get involved with that, and Greg coordinates that as well. So I think it's a great avenue for people, the community, to have a say in this area. And it's one of the few local government areas that does have one where the community can get involved with both the service providers and other people as well. So I think it's a great thing.
Thanks, here. Thanks, Paul. Thanks for that. You can contact me through the Yarra Drug and Health Forum website, which is www.ydhf.org.au.